Thank you for taking the time to explore weight loss surgery at UnityPoint Clinic Weight Loss, West Des Moines. This seminar contains much of the information you will need to determine if this surgery is right for you. Upon completing the seminar, you will be asked to fill out a form that lets us know what you would be interested in learning more about.
Today, you will learn about the disease of obesity, associated risks and treatment options, the surgical procedures offered at UnityPoint, what you will be asked to do as you prepare for surgery, what you can expect after having bariatric surgery, and how to get started in the process. There is no pressure to commit to surgery right now. Today's session is all about gaining the knowledge you need to help make an informed decision about your health. We will be referencing a medical condition called obesity throughout this seminar. We are discussing treatment options available for those with a body mass index or BMI classification of 30 or greater. While BMI itself is a relatively poor indicator of overall health, it is one method of estimating the degree of health risk associated with weight. We will talk more about this in an upcoming slide. Individuals with a BMI less than 18.5 are considered underweight. Having a BMI of 18.5 to 25 is considered normal weight. A BMI of 25 to 30 is considered overweight. There are typically few health risks in these two categories. A BMI in the 18.5 to 30 range is generally considered as healthy. Obesity is broken into three categories: Class 1, BMI 30 to 35, Class 2, BMI 35 to 40, and Class 3, BMI above 40. Class 3 obesity is sometimes referred to as morbid obesity. Morbidities are symptoms of disease. A higher BMI is associated with several health risks like diabetes, heart disease, sleep apnea, high blood pressure, and joint pain. You can see the many health risks associated with obesity. You may have some or many of these health conditions already. The reason obesity develops is multifactorial. Genetics, environment, and behavior all play a role in how and why some develop obesity and others do not. Diet and exercise alone are often ineffective at treating obesity and chronic health conditions, particularly once a person's BMI exceeds 35. Like diabetes and other diseases, obesity treatment requires a team of experts and evidence-based approaches. Medications and frequently surgery need to be considered for long-term weight loss and improvement in obesity-related health conditions. UnityPoint has an accredited bariatric and medical weight loss program. This means that we offer surgical and non-surgical weight loss options that are recognized as safe and effective. The programs are overseen by physicians who specialize in the treatment of obesity and are focused on continuous quality improvement. Not all centers that offer weight loss surgery are accredited. Our obesity medicine team provides expertise in treating obesity through using prescription weight loss medications or meal replacement therapy. These options are often most appropriate for those with a BMI between 30 and 40 who have relatively few obesity-related health conditions and otherwise do not qualify for weight loss surgery. On average, a 10% weight loss can be expected while taking medication, but results will vary depending on which medication is prescribed. For example, if you weigh 250 pounds, about 25 pounds of weight loss is expected. It is unlikely to achieve and sustain weight loss that is greater than 10% without surgical intervention. If your BMI is greater than 35 and you have health conditions associated with obesity, or your BMI is greater than 40, bariatric surgery should be strongly considered as the most effective treatment option for your obesity. Bariatric surgery is not for everyone. It is important to understand the risks and benefits involved when making this decision. Though there are many surgical procedures performed for weight loss around the world, the procedures we offer at UnityPoint are consistent with the safest and most effective weight loss surgeries performed in the United States. These procedures are the sleeve gastrectomy and the Roux-en-Y gastric bypass. Both procedures are endorsed by the American Society for Metabolic and Bariatric Surgery. They have a track record of helping patients achieve significant and sustainable weight loss and resolve or significantly improve many obesity-related health conditions. Let's take a closer look at both of these procedures. Click on each picture to see how the surgery is done. While the operations themselves may look complicated or risky, the overall risks are similar to those of a knee or hip replacement. Your surgeon will talk through these procedures with you in more detail and take your individual health conditions into consideration to work with you in determining which option is best. This graph shows the maintenance of weight loss after surgery. Patients on average who had a BMI near 50 before surgery achieved and maintained a BMI in the 30s for many years after either procedure. In addition to weight loss, bariatric surgery often dramatically improves diabetes, high blood pressure, and high cholesterol. Both procedures can significantly improve your overall health and quality of life. Most patients experience improvement or remission of several obesity-related medical conditions after bariatric surgery. This is a picture of common obesity-related medical conditions that have a high chance of improvement after surgery. There are many other conditions not listed that also improve after bariatric surgery. Chances of health condition improvement are unique to each individual patient, and your surgeon can answer more questions about your individual conditions. Now that we have looked at expected weight changes and health improvements, let's discuss complications. While both the sleeve gastrectomy and Roux-en-Y gastric bypass have been proven to be safe procedures, these are major abdominal surgeries that do have associated risks. Rare but severe complications include a leak or a bleed along the staple line, deep vein thrombosis or blood clots, a stricture or narrowing of the stomach, or need for reoperation. There is also a low risk of mortality or death, well less than 0.5%. Risks of these complications are very low and are different for each patient. Your surgeon will discuss your individual risks with you at your office visit. In summary, weight loss surgery has been shown to be the most effective method for sustained weight loss and improvement in diabetes, high blood pressure, high cholesterol, and sleep apnea in patients with obesity. There are many other health conditions that are likely to improve after bariatric surgery as well. While there are risks associated with these surgeries, the overall rate of complication is low. You will discuss the risks of surgery in more detail when you meet with your surgeon. Let's discuss how you will be evaluated for and prepare for a successful surgery here at UnityPoint. Having bariatric surgery is life-changing. It is more than just a surgical procedure. It is a tool that can help you live the life you want to live as long as you know how to use it. On average, preparation for surgery will take 3 to 6 months. If after today you decide to further explore bariatric surgery, we will check your insurance benefits to make sure that bariatric surgery is covered under your insurance plan and that you can have your procedure done at UnityPoint. Every patient will have an extensive pre-surgical workup. You will meet your surgeon and medical team, including advanced practice providers, dietitians, and other office staff who will oversee your preparation for surgery. You will attend nutrition visits and complete any pre-surgery blood tests, procedures, or exams that may be necessary depending on your personal health history. Your preparation may also include some therapy work or meeting with an exercise specialist. You may be asked to lose weight as you prepare for surgery. These requirements are for your safety and readiness for your new life ahead. It is important to note that each insurance company has their own set of criteria that need to be met for them to pay for your surgery. Some insurance companies require a minimum of 6 months of nutrition visits, specific labs or tests, or your primary doctor's okay for you to have surgery. These items may be above and beyond our program requirements and vary depending on your specific insurance. If you have more than one insurance, you may need to meet the criteria for each insurance company before you can have surgery. If your insurance changes during your preparation for surgery, you must notify us immediately. Not all insurance companies or plans cover bariatric surgery, and few companies have the same requirements for your preparation. After you complete all pre-surgical requirements and you have been given clearance by the bariatric team, your file will be submitted to insurance for prior authorization or the okay to proceed with surgery. It typically takes 2 to 4 weeks for a company to respond with an approval for surgery. Once approved, we will call you to schedule your surgery and you will complete your preoperative appointments. Pre-op appointments will occur 2 weeks before your surgery date. Then it's surgery day. After your procedure, you can expect to stay in the hospital 1 to 2 days. Our expert nursing team will ensure you are recovering well, your pain is managed, and you are well hydrated, with our goal to get you back home safely and as quickly as possible. After that, the hard work begins. You will be putting into action the principles you learned during your months of preparation. After bariatric surgery, lifelong follow-up is critical for success. There are vitamin and mineral supplements you will need to take for the rest of your life and blood tests that you will need to complete each year. You will need to see the bariatric team every few months for the first year following surgery and annually thereafter for the rest of your life. We will reach out around the anniversary of your surgery to schedule appointments and ensure that you have the resources you need, are taking your vitamins, and getting your blood levels checked. In addition to lifelong follow-up, we strongly recommend that you attend our support groups, which are offered every other month. You will have the opportunity to meet other bariatric surgery patients, share in any struggles, and celebrate scale and non-scale victories. Support group is free of charge and covers a variety of topics. We want you to succeed. Your success is our success. Because of this, you will be supported by a team of expert surgeons, advanced practice clinicians, dietitians, nurses, and other bariatric team members.
If you believe weight loss surgery may be right for you, please fill out the form at the link below with your name, date of birth, and contact information. When we receive your completed form, we will contact you to schedule a consultation with a surgeon. This concludes the informational seminar. If you have any questions or concerns, please contact us by phone, email, or through the MyChart patient portal. Thank you for watching. We look forward to meeting you.